Metronidazole-associated encephalopathy. Definition: Metronidazole-associated encephalopathy is a toxic encephalopathy associated with the use of metronidazole. Metronidazole is efficacious in treating trichomoniasis, amebiasis, and giardiasis, and in infections caused by obligate anaerobes and microaerophilic bacteria. Encephalopathy associated with metronidazole use is an uncommon side effect of the medication. It typically manifests as dysarthria and gait instability. Risk factors include liver dysfunction and a prolonged course of metronidazole, typical cumulative dose over 20 grams.
Hi, I'm Dr. Greg Hall, and for whatever reason, your doctor or a nurse practitioner has put you on Flagyl or metronidazole. It's a medication they use to treat a wide range of things, but it's a medication that I thought it was worth doing a little video on just to make it clear. Sometimes they'll give you a big dose of it, like 2,000 milligrams, where they might give you 4 or 8 pills to take all at once. Other times, they'll give you the pill to take 3 times a day for a period of like 7 days. Either way, you'll want to take the pill however it's prescribed, which makes sense. Many of my patients will say that Flagyl or metronidazole is a very bitter pill. What a bitter pill. Well, you're going to want to take it with orange juice or some kind of a juice because it has a bitter taste, and you're going to have to just get past it some kind of way. But just be forewarned that that's an issue. The other issue with Flagyl or metronidazole is that it has an anti-abuse effect. Now, what is that? An anti-abuse effect is if you drink alcohol with Flagyl or metronidazole, Flagyl, it's all the same. It can make you so you get violently nauseous and vomit. Okay, it's not going to kill you or anything, but at times you may wish you were dead. But it will make you nauseous and vomiting. So sometimes, they'll say no medication, no alcohol, no medications, and it may or may not be true. But with Flagyl, it's true. Do not drink any alcohol for days after you've taken it. If you take the big dose, you want to make 2-3 days after you take the big dose, and then certainly any time you're on those smaller doses, the 3-time-a-day doses, stay away from alcohol. If you don't, you will live to regret it. That anti-abuse effect is no joke. Okay, so that's our short little thing on Flagyl. Take it straight. It should clear up anything. It's a medication that's been around a very long time, very well tolerated. You'll do fine. For now, I'm Dr. Greg Hall.
Pros: Metronidazole is primarily used to treat bacterial vaginosis, pelvic inflammatory disease, pseudomembranous colitis, aspiration pneumonia, rosacea, fungating wounds, intra-abdominal infections, lung abscess, periodontitis, amebiasis, oral infections, giardiasis, trichomoniasis, and infections caused by susceptible anaerobic organisms such as bacteroides, Fusobacterium, Clostridium, Streptococcus, and Prevotella species. It is also often used to eradicate Helicobacter pylori.
For Global Medical News Network. Results from a new study found that oral metronidazole was just as effective as oral vancomycin for treating Clostridium difficile diarrhea, regardless of the severity of illness.
As we all know, antibiotics, which are used for different infections, can cause different side effects. And antibiotic-associated diarrhea is one of the most common side effects caused by Clostridium difficile, C. diff. And so the C. diff treatment guidelines from RDSA is published in the month of May last year, 2010. So as per the guidelines, the infection can be classified into mild infection and severe infection. So our objective was to look at the patients who receive both and look at their outcomes, which means complications and recurrences.
So based upon this data, we come to the conclusion that metronidazole was non-inferior to vancomycin, irrespective of the severity of illness. And the rate of recurrence there's no difference in the rate of recurrence between metronidazole and vancomycin groups, irrespective in severe illness. While in non-severe illness, there was a difference. And there was no difference in the rate of complication between both of these two groups. So based upon this data, and we had some limitation that is our retrospective study. It's a short, small population size, and in our study, because we're a Veterans Affairs hospital, so majority of our patients are males. So we don't have many of the females. We only have 2 females, mainly in the metronidazole group. So based upon this data, it's hard for us to draw a clear-cut conclusion because of retrospective analysis, but still we are posing this question to healthcare professionals: that is the managed treatment for the Clostridium difficile diarrhea, especially in severe illness, is vancomycin justified for it, especially in this era of healthcare, when the cost effectiveness is very important. So same management, metronidazole can be much cheaper as compared to vancomycin, it can be much more expensive.
Cons. Metronidazole may produce diverse adverse reactions like nausea, dysgeusia, anorexia, and abdominal cramping. Neurotoxicity has been readily reported, with features ranging from headache, incoordination, and ataxia to convulsive seizures, optic neuropathy, and peripheral neuropathy, and encephalopathy. Applications in medicine. A 58-year-old man with cryptogenic cirrhosis was admitted to the intensive care unit with confusion after a fall home. He had been taking a prolonged course of metronidazole, 500 mg 3 times per day, for more than 3 weeks, for Clostridium difficile infection. A few days before his hospitalization, his heart rate and gait instability had developed, which had contributed to the fall. A magnetic resonance imaging scan of the brain showed a symmetric, enhanced fluid-attenuated inversion recovery signal in the dented nuclei of the cerebellum, a finding that is consistent with encephalopathy associated with metronidazole use. Discontinuation of metronidazole resulted in resolution of the imaging findings 1 month later. Neurologic assessment was difficult, and the patient never regained his baseline mental status.
So, hello, everyone. My name is Greg Herbs. I'm the Chief Scientific Officer of the Children's Nursing Hospital in Missouri. I'm also in charge of the Children's Pediatric Center. I also serve as the Director of the Psychopathic Core for the Pediatric Trauma Ward. It is my opinion that so that study started on a very good, concrete study. We wanted information about the pharmacokinetics of the headline pointer study. The study was conceived, and we found something that we looked predictable, right? We saw from the other. That's the peculiar
Conclusion: metronidazole may produce neurologic side effects such as cerebellar syndrome and encephalopathy in rare cases. We show that metronidazole-induced encephalopathy can be reversed after cessation of the drug. Early diagnosis by using brain magnetic resonance imaging and prompt cessation of the medication bring most benefits to patients. Non-alcoholic Wernicke's encephalopathy is an important differential diagnosis and may share a similar metabolic pathway with MIE, resulting in difficulty in diagnosis.
Hi, Dick Olbert here, continuing our infectious disease lecture series. Today we're talking about flagyl or metronidazole. We have a case of a 21-year-old sexually active female who presents with a very odoriferous vaginal discharge. Smells very fishy. She has the positive whip test, and vaginal stains show clue cells. He diagnosed bacterial vaginosis and place her in metronidazole, and she gets better. The next day, you're working in the health department and diagnose a patient who has trichomonas vaginal infection associated with a strawberry appearing cervix, and treat the patient with metronidazole also. So metronidazole has been an antibiotic we've used for decades. It's an excellent antibiotic. It's in the nitroimidazole class. It acts by forming ether bonds with cysteine-containing enzymes in the organism by being reduced to nitroso intermediates. It's really certainly one of our best anaerobic antibiotics below the diaphragm, very effective for Bacteroides fragilis and other anaerobes. Unfortunately, above the diaphragm, it's got very poor lung penetration, but it's also good for certain protozoa such as Ectoamoeba histolytica, as we mentioned, Trichomonas, and then very good for Giardia. We've been using it for years for Clostridium difficile diarrhea, as well as rosacea, and as noted in our case presentation, bacterial vaginosis or BV. Watch for adverse effects, which include a bad taste in the mouth, a disulfiram reaction with alcohol use, central nervous system changes or neuropathy changes, and then, of course, GI side effects. The dosing is 500 milligrams, generally 3 times a day orally, or IV, and 0.75% topical. So this is just a nice review on the antibiotic metronidazole or flagyl. It's got a lot of uses. Be aware